Well, welcome, everyone. My name is Joy Burkhardt, and I'm the founder and executive director of the Policy Center for Maternal Mental Health. We're so glad to have you with us today in our second webinar in our summer series addressing workforce and treatment options for maternal mental health. Today is going to be a really exciting session. A few slides to talk a little bit about peer support and the work that we've done around maternal mental health. Certified peer support specialists. But we're mostly going to have an engaging conversation with our guest, Michelle Lacey, who's joining us from Arizona to talk about how she's worked to employ peers and the role that they serve at Women's Health Innovations in Arizona. So we're glad you're here with us today. A few housekeeping items I wanted to share. We invite you to drop any questions you have in the Q&A box of Zoom here. We'll have time at the end of our presentation to answer questions. We will also be sharing some resources in the chat with you about maternal mental health peer support, so be on the lookout for that as well. And if you have not signed up yet for our e-newsletter, we invite you to do so at our website, policycentermmh.org. Great, I would like to advance to the next slide. So I wanted to share a few resources, as I mentioned earlier, that we have available on our website, and really excited to say that one of our missions is to close gaps in maternal mental health. And one of the ways that we do that is by addressing workforce shortages. And so we have looked at the role of certified peer support in mental health more broadly and realized that there was a great opportunity to address peer support in maternal mental health for all the reasons you may be aware of, right? The workforce shortages in mental health more broadly, the super shortages in maternal mental health. And of course, we all know that women and perinatal population really have a desire to connect with each other. And that is a perfect intersection for solving these shortages with the use of peers. So you'll find on our resource hub, which is linked here below, we're also dropping a direct link into chat for you, an issue brief that's a comprehensive overview of the use of certified peer support specialists in America, the background, also the pilot studies that we have run around utilizing this framework for maternal mental health. What is certification? What does billing look like in this space? So we invite you to take a look at that issue brief. If you haven't yet, it's what you're going to want to get your hands on after today's session. We also have on our resource hub comprehensive resources, including billing guides issued from SAMHSA grantees, so the Federal Substance Abuse and Mental Health Resources Administration, and also information about certification and training by state. So this is going to be really important as we all look to propel the use of certified peer support specialists in maternal mental health. All of that information is on this resource hub page for peer support. Next slide. Before we dig in today, I just wanted to level set and share a little bit more about peer support in general. Both SAMHSA, the federal agency SAMHSA that I mentioned earlier, and also the Centers for Medicaid and Medicare Services, CMS, recognizes the value of peer support because it's evidence-based. You can see that first blue bucket notes that since 2007, for quite some time, SAMHSA has recognized the value of peer support. Peer support work started in the substance use disorder space and also the severe mental illness space. For those of you who are looking for more history, you'll find some links on that resource hub page of our website. So really anchored in peer support for, again, substance abuse. If you think about the AA program, for example, or those who are severely mentally ill, needing a companion to navigate care and resources. Peer support is defined as an evidence-based mental health model of care, which consists of qualified peer support providers who assist individuals with their recovery from mental illness or substance use disorder. It recognizes that the experiences of certified peer support providers, those with lived experience, as consumers of mental health care services themselves, can be an important component of a state's delivery or the United States delivery of effective treatment. Next slide. So what do peers provide? What kind of supports do they provide? just to make sure we're all on the same page. So emotional, so empathy and friendship. Informational, so connection to resources in the community, perhaps support with connection to who is in network in a provider network, for example. So instrumental support, so concrete supports. This is what we would normally consider social determinants of health, or what we are and others are calling societal drivers of health supports, such as housing or employment. And affiliation support, so connection with affiliations to communities and organizations in the community that may offer emotional support and healing as well. I would also add, and you'll hear this during our conversation with Michelle today, that there can be other roles, including supporting providers in doing particular work, like care coordination, for example. So a few more roles, but these are the baseline roles of peer support specialist. Next slide. Just quickly, we wanted to distinguish between informal peer support, which there's value for, certainly, those with lived experience talking with friends about their personal experience with a maternal mental health disorder. But there's also this professional designation of a certified peer support specialist. And what is a certified peer? So certified peers, according to CMS, must complete training in delivery of peer support services and also certification. We'll talk about what certification means in just a moment, and that's defined by each state. The training provides basic peer support providers with a basic set of competencies necessary to be a professional peer support worker. And those who are certified, so you can be trained but not sit for a test and become certified, become certified in their state through a state agency's certification board, which may be the same provider that trains peers in the state. And the testing ensures that the peer retains basic knowledge about the training and also allows them to be issued a professional credential to put after their names, which is, we think, really important to both distinguish from who's certified and to give the peer who's completed training that professional designation. All states now have a state-sanctioned peer support training and certification process. There are some gaps, however, with regards to several states having state-sanctioned peer support training and certification in place, perhaps only for substance use disorder. And those are gaps that we're working with partners in these states to start to close. Next slide. And we already talked about what it means to be certified. We also just wanted to briefly talk about reimbursement. And this slide highlights that there is Medicaid reimbursement in most states, many states, for certified peer support specialists. As I mentioned previously, there are some gaps with regard to reimbursement only for substance use providers, substance use peers. Not for mental health, and we're working to close those gaps. You can see some more information on the website here, or the slide rather, on how the reimbursement process works through waivers. We also wanted to flag that commercial insurers are not yet reimbursing for state certified peer support specialists work, and we are looking to support closing those gaps. Mental Health America, who's a partner of ours, is also working to champion and encourage commercial insurers to reimburse for certified peer support. All right, next slide. I now have the great pleasure to move into the fireside chat component of today's session. And I want to introduce my friend and a dear colleague who's been in the maternal mental health space for, I think, longer than just about anyone. There's a handful of you out there, Michelle Lacey. And Michelle is a licensed professional counselor and certified perinatal mental health clinician, a PMHC. And Michelle is the executive director of Women's Health Innovations, or WHI, of Arizona, which is a nonprofit licensed outpatient treatment center specializing in perinatal mental health. She has extensive training in maternal mental health, as we just discussed, and also maternal OCD and trauma, which we so appreciate that expertise in you, Michelle. She's also been a member of the Postpartum Support International since 2002. Again, one of the longest standing champions, I think, in maternal mental health, and serves as the state coordinator for the PSI chapter of Arizona, and national trainer and subject matter expert. Michelle also served as the board president for Postpartum Support International's Arizona chapter previously. So, Michelle, we're so glad to have you with us, and want to just remind folks, as you'll see on our resource hub, that we had the great opportunity to run 2 pilots in maternal mental health and the use of certified peers. And the first pilot, we worked directly with Women's Health Innovations to pilot the use of certified peers for maternal mental health, to see if this was a framework that would work in our space. And of course, we found that it would be. And we're so pleased to have Michelle with us today to not talk about the pilot per se, but really how WHI now has run with implementation of peers in their own nonprofit behavioral health organization. So, Michelle, welcome.
Thank you so much for having me. I'm so thrilled to be here today.
Great. Well, Michelle, to kick us off, would like to have you first tell us just a little bit more about WHI. Um, who do you serve? What does your community look like?
Sure. So we started about 8 years ago when we saw there was a huge gap of services for perinatal mental health. We knew at that time that if you had really great insurance or could pay out of pocket, you could get services. And there was such a large group of people that were being missed and overlooked. And that just sort of drove it. So we started out in a 10 by 10 office with 2 of us volunteering, as we say in early nonprofit world. And today we have 25 therapists, we have 8 peer support specialists, and we serve women across the lifespan, but we do have that specialization in maternal mental health. All of our providers, including our peers, go through perinatal mental health training through PSI. All of our therapists will sit for the PMHC. We also send our therapists through trauma training, specifically EMDR training. We have a subgroup of providers that are ERP trained to treat OCD, and then we have a specialty in perinatal grief and loss. We also provide parenting support, and 2 years ago, we launched our young children's program, Birth to 8. And primarily what we were seeing were parents sharing concerns about their children. And we also know that parents will bring their children in first before they will address their own needs. And so we had a great opportunity to expand our program to work with the entire family.
Great, Michelle. I'm sure others like me are thinking, oh my gosh, how do we get a WHI in every community? I do want to flag that Arizona and the community that Michelle serves is one of what we call hotspots for maternal mental health disorders. Both Houston and Arizona are really our top
Mm.
2 opportunities or populations with the highest needs. So, Michelle, we're particularly grateful that you're based in Phoenix doing this work. For those who want to know more about our hotspots and needs map, we call it our resource and risk map. You can find that information on our website to see where your community falls. Michelle, great. So that's helpful background. And it's so exciting to see how much you've grown since you started. I think there may be some other nonprofits with us, or even behavioral health organizations that are for profit that are in this space and wanting to grow like you have. So we talked a little bit about the pilot that we ran together, where we trained some peers, actually both in Houston and Arizona,
Mhm.
with Women's Health Innovations, and also in Houston, partnering with 2 training organizations. In Arizona, it's RI International that provides general peer support training, and Via Hope in Houston. And all of that information is on our website if you're wondering who trains peers in general, not maternal mental health per se, but general peer support training. That's on our website. But so we piloted this work. It's been 5-6 years ago now. And tell me what happened after some of you helped identify women who had lived experience that might be ready and excited to serve in this kind of capacity. They were trained as certified peers, became certified in Arizona, then what happened next?
Well, we just had a passion for peers. Many of us in leadership have come from the substance use treatment world, so we knew the value of peers. And at the time here, there were limited resources, so we knew our peers could bridge the gap. So initially, we were able to hire a handful of the peers that we trained through that pilot, and we had a small grant along with some donor funds, and then we reinvested some of our revenue into the program. And we were doing pre-COVID, we were doing in-home peer support services. Then the pandemic hit, and we had just started doing bedside support at one of the hospitals with our peers when the pandemic hit. So we had to pull that back. And at that point, we thought, well, we've got to figure out a better way to use our peers. So we began to have our peers do our initial screenings with clients. And that allowed us to get people in within a week. And so our peers become a part of our team, and they're employed by us. We can bill for some of these screenings, not all of them, because the people we can bill for are the Medicaid clients. The rest of it we supplement through our revenue. From there, it just grew. And so today we have 8 peers, as I mentioned. Some do administrative work and some do those screenings. And then we have another pocket of people who do our Spanish speaking community-based support groups, educational groups within another one of our community partners. And we have 2 peers that go bedside at 2 of our hospitals for about 3 hours a day. Our hope is to grow that and to add more hospitals to it, in addition to more peers and more time. We have to get funding for that. But the whole purpose of our peer supports at the bedside is to really meet the people that are identified at risk and bridge the gap so they don't fall through the cracks, right? So they have a face to see and someone to connect with. And what we've learned just since March is that we've seen about 250 women additionally, or birthing people additionally, than we have seen in the past. So to get them connected to services within our community.
Okay, so what I'm hearing is there are lots of hats that peers can play and lots of
Yes.
places they can sit.
Yes.
Um, let's unpack some of that together right now. And so let me back us up just a little bit. And what I'm thinking that our community would be really find helpful, Michelle, is to talk a little bit about the role that they play in the clinic, and then we're going to revisit the home visiting piece. I know everyone's interested in that, and revisit the hospital,
Sure.
inpatient hospital bedside services. So if we start like in your clinic setting, um, the services that your peers are providing, you mentioned that they may be screening. So for patients who perhaps aren't screened by their obstetric provider and then referred, or perhaps are screened, but then you do intake and
Mhm.
then rescreen. Can you just talk us through what does that look like? So if a patient comes to you, what does it look like? Do they all get interaction with the peer support specialist? How does that look?
Yes. So their initial actually, even our person at the front desk is a certified peer. And so the person scheduling is a peer. And then the initial screening involves more than just doing the EPDS or any other screening tools. It's really an opportunity to have them connect one-on-one, face-to-face with someone, whether it's virtually or in person, just to share about what brought them in. It's to help ease that. And so with a peer doing that, and they introduce themselves as a peer support and what their role is. So that's a big part of what our peers do, is that initial screening. And what that does is allow us to get people in fairly quickly. So if an OB will call and say, I need somebody to be seen immediately, they will be able to see a peer quickly. And then the peer works directly with our clinical leads to give the history and understand what needs to maybe be expedited if someone is in crisis, or if it's, what their needs might be at that point. The other thing that our peers do is work hand in hand with our therapists. So sometimes a peer will need, a parent will need just day-to-day support and parenting support. And so we will pair them with a peer, and they might be working with a therapist on their trauma or addressing their OCD. And so there's great, they are, our peers are a significant part of our team, um, especially with maternal mental health, on meeting parents and supporting them on the day-to-day stuff that can be overwhelming at times. And, here in Arizona, we don't have an intensive outpatient maternal mental health program. So sometimes our peers are part of that process of just having eyes on someone more than just once a week when they see their therapist.
That's helpful. Um, I'm going to back us up one more time because I'm also thinking about, wow, I hadn't thought about the fact that your front desk, like your scheduler,
Mhm.
who's doing more administrative work, but happens to be a certified peer support specialist. So to just clarify, that person, it sounds like, is not in that function, at least providing actual peer support services. But the fact that she, I assume, is
Mhm.
also a peer support specialist gives your office, that just helps make every single employee, it sounds like, have some sort of recognition of what it's like to have suffered, and some sort of training on how to use your lived experience to support
Yes.
people in community. Very good. I appreciate that. So I'm going to back us up one more time, and
Sure.
I really can't wait to dig into some of the questions that I think are coming in the Q&A. But one of the things that I suspect people are thinking about is, okay, I see that peers can provide support and recovery and day-to-day capacity support for behavioral health clinics. We're actually believe that some of this support could be provided in obstetric care settings
Yes.
as well. But in a behavioral health clinic like yours, what did it take to get your clinic ready to
Mm.
employ peers? So you mentioned you did a lot of it on a sort of volunteer basis with earned income. I know you host fundraisers because I've been to one. You're a nonprofit and raised some money perhaps to do some of this peer support work. But what else did you do to become ready to bill Medicaid and hire employees?
Yeah, so that was the big undertaking for us, which was we became a licensed outpatient treatment center by our Department of Health here in Arizona. And we did that purely to bill our peers. So once we became an OTC, we were able to get our Medicaid number. And then once we had that, we were then applied for each of the various Medicaid plans that are here in Arizona. So it was a long process. Since we got our initial OTC licensing, we've had a survey come out to just assess where we're at. And we are also opening a second office now, and we're trying to get that licensed to be able to do the same thing. And every question we get is, well, you should be a counseling facility, not an outpatient treatment center. But under that counseling license, which we've had in the past, we can't bill for our peers for Medicaid. So we had to do the OTC, and that involves a little more work, but it's important to us to be able to provide the service with our peers because we know that they're such a significant part of our process.
Got it. Okay, so I'm going to recap for folks.
Sure.
Which might apply to those of you who are joining us from behavioral health clinics that might be for profit, right? Maybe you're licensed in a certain way and need to research with your state whether you need a separate license to provide peer support specialist care and bill for their time. All of that should be on our website. If you run into trouble, we will help you navigate that in your state. And then, Michelle, you also explained as a nonprofit, you were already a licensed provider in Arizona, but also had to follow the same sort of research protocol and figure out that you needed a separate license to bill peer time. So that seemed like step one. And then
Mhm.
Michelle also clarified that, just because you're a Medicaid, you have are able to bill Medicaid doesn't mean that you're in network with the Medicaid health plans or contractors in your state, if it's a fee for service state, the insurers in your state to provide these services. So Tell us a little bit about what that was like and how many health plans did you have to outreach to ask to become in-network providers? Can you tell us about that?
Sure. So we have, believe 8 plans under our Medicaid program here. And so we had to apply for each, and I say I have one full-time person who did all of this to apply to each for each provider, and then under our license for our peers. And we did not get approved right away. So for some of them, we had to appeal up to 8 times in order to get approved to bill the Medicaid plan. So it was a long process, but it was worth it. I think for me, I see, we have to look at the big picture, and the big picture was increasing access to care. And maybe my stubbornness was really helpful in this regard because we weren't going to give up. We were going to keep pushing through. And now that we bill all of the plans, we are seeing that we are reaching more people, and that's why we've been able to grow. And so it was worth it in that regard. Some days though, there's a lot, we have extra things we have to do, but it's worth it in the long run.
Thank you, Michelle. And I think it's helpful to give folks a realistic view of how complicated it can be to get prepared to bill Medicaid. But as you said, perhaps the payoff is great because you want to increase access. And also want to spend a little time talking about reimbursement. It looks
Mm.
very different in every state and can get very complicated quickly. But I would love for you, Michelle, to just talk a little bit about perhaps high level what your revenue from peer support looks like. And Michelle, I didn't prep you for that question. So if that's a hard one to answer,
Sure.
answer in another way. But what kind of income stream, are you covering the time that you're paying in salary or part-time, billable hours?
Sure.
How is that working out?
So so here we're a fee for service state, right? So then we get a percentage of the fee for service rate, and that's different with each of the plans that we bill. So it's a great opportunity for our bookkeeping person to really figure that out. But what I will say is that we do cover probably half of the salaries that we have for our peers that are doing those initial screenings and the bedside support, and it's all under one umbrella. For us, we have to have multiple revenue streams. Well, so we have the Medicaid billing, we have contracts to provide the community-based support groups and education groups. And then we also have our side of it where we have to have multiple revenue streams for that. It's just how it is.
But you've managed to make it work with peers
Absolutely.
and and
Absolutely.
and be able to use them for some of these other revenue streams too. So let's move back into some of that. And I know some of you probably have some good questions about billing and reimbursement coming to the Q&A. We'll circle back to that in just a minute. So you started by explaining. So I think we got the day-to-day kind of clinic support,
Mhm.
screening and intake and peer support in between the time that patients can see their therapist once a week. And that sounds awesome and really important. You also hit on the fact that you were using peers initially in home visiting settings.
Yes.
Can you tell us about that? What did they do? Were you billing at that time, or was it covered through
No.
fundraising, revenue, other
So
sources?
we were part of a community partnership grant, and it was working with parents who had babies that had come home from the NICU. So we were just providing the mental health support and education. So really at that point, our peers went in and did exactly what you were talking about earlier. They were just empathizing and giving them information and also helping them connect to community resources. So when people come home with a fragile infant and they're traumatized by what they experienced in the NICU, sometimes our peers would sit down with the parent and just help them make the phone call to the therapist or the follow-up care for the infant, just so that there was somebody there walking with them through that difficult time. And that was a really exciting time for our peers. Some of them had babies some of them had delivered multiples that were fragile. And so our peers going into their home were sometimes the only support, social support that they were getting at that time. So, but again, it was a community partnership grant that we were working off of, and then the pandemic hit, so we couldn't do that anymore
Got it. I'm sure
that way.
some of you on the line are thinking, oh gosh, maybe through our public health department, we could provide in-home peer support services outside of our perhaps traditional home visiting programs, if you have those, or if you don't have those, maybe something like this could work. So we're really interested in sustainability of these types of programs and billing. And I just wanted to flag that from what we understand, there are could be no restrictions on what's called place of service bound. So if services,
Mhm,
peer support services are provided in home, they could still be billed to Medicaid, for example. So if
mhm.
folks run into barriers there, would love to hear about them and help work through them. But just wanted to flag that even that program, right, that it was funded through a grant, perhaps in other places or even Michelle down the road, right? Billing Medicaid could
Yeah.
be feasible there as well.
So I just want to make a point that we do offer like what we call coaching, right? And we can bill that under one of the H codes for Medicaid. And we can do virtual visits. Now we see people all over our state now. And so if we have parents that are getting coaching services or with a peer support in tandem with their therapist virtually and home. So we're doing a modified version of that now, especially for our parents that are maybe in rural communities, are a little more isolated. Connecting with our peers virtually has been a significant piece of that.
Great. Thank you, Michelle. Um, Excellent. So let's move back to a bedside
Yes.
delivery of peer support services. Talk to us about your partnerships with hospitals. And when we say bedside, what do you mean? Labor delivery, high risk? What
Yes, so our peers are on at two different hospitals every day for 3 hours. And they will visit the antepartum unit, the NICUs, the postpartum unit, sometimes labor and delivery if it's a really high need case that needs just more connection. I think it's really important to state that our partnerships and collaborations are key in providing and meeting the needs of perinatal families. And our partnerships with the two hospitals that we're in right now have been significant in allowing us to get in there and share information, refer to community partners, because initially we have a small grant that helps with that, and that's a community partnership grant as well. We also bill some of the follow-up care that we've added into that. And then we also contribute our funds toward that. So to be able to grow, to be able to sustain it for every day of the week. Our goal is to get more hospitals involved and more time. And our next goal, and we've been talking with some OB clinics, and I want to bring this up because you brought this up, is to get some of our peers in OB clinics so that they can be utilized in that with capacity as well.
Great. Thanks, Michelle. I'm really excited about the possibility of expanding OB capacity to screen and provide support, brief intervention through peers or community health workers. So thanks for mentioning that. Um, I love that. Could you give us just a little bit more background on the partnerships with the hospitals that you're working with? Who are the hospitals? I think some of these are
Mhm.
large hospital systems that perhaps could be interested in providing these services in other states where we have
Sure.
listeners. Who are they and how did they find you?
Yeah, so we've been working closely with Common Spirit Health, which here it's Dignity Healthcare, and a larger umbrella in other states is the Common Spirit Health. They've always been a huge supporter of maternal mental health. We have a few contracts with them to provide, and we've had it for probably for 6 years, providing a therapy group for that for them on their campus and then virtually. And then they, because of our partner continued work with them, we've trained their staff, and they really have been excited about this bedside support. So we have Mercy Gilbert Medical Center here in Gilbert, and then Chandler Regional Medical Center in Chandler that we are working with right now to provide that bedside support. We've established, I think it's really important grow relationships. And our organization comes from a relational model anyway, which is that people heal and get well being in relationship with other people, which fits so well with maternal mental health. But we believe that within our clinic, but with also within our partnerships. And I think as you mentioned earlier, I've been doing this work for a really long time. So establishing those relationships and talking to people about the importance of collaboration is what's allowed us to be able to go into the bedside.
Great. I know when you and I talked a little bit about this, Michelle, you were thinking about how do I sustain the bedside services? Do I employ the peers and then contract out to hospitals to be reimbursed for the support, or do I work to support hospitals in employing peers? Can you give us an update on, or give me an update and let others hear benefit from our conversation here? On where does that stand now? How are you thinking about it? What are the barriers and
Mhm.
challenges?
I think it's peers being our employees. One is, and then because then we have multiple ways of billing. So we have our Medicaid billing, we have other contracts, we have grant support, we have um, donors to be able to support that bedside support, and then creating those relationships. That has been the most effective way to keep it going and sustaining it. Our organization is really known to be focused on that specialty of maternal mental health. That's our expertise. That's our area of specialty. So when people need that additional support, they know they come to us. So for us, being able to say, here are our resources, here's what we can offer. And so going into our partners, working with our partners and going into those organizations has been what we have found over the last 5 years in various capacities, the most effective way to do it. And so that's what we're doing with our peers at this point. We actually just promoted our original peer to a peer lead. She actually went on to get her LMSW. And so she got her MSW and now is a licensed therapist. So she's overseeing all of the clinical needs or any clinical support and encouragement of our peer supports, which is really exciting, so that there's some oversight there.
That's great, Michelle. And I think that's often a concern about peer support, or even doula or CHW, community health worker support, is like, what is the ladder to build up and develop your career? And so it sounds like you have been supporting peers and becoming, at least once
Mhm.
here, and becoming a licensed clinical professional as well. So it's great to hear about that pathway. I'm going to now turn to some Q&A. And as I do that, Michelle, I want to give you one more question. And that is, tell us about the billing codes that you use, even in the clinic
Sure.
setting, for services. And again, we know that there's variance by Medicaid agency, by plan or insurer type, if you're in a fee-for-service state, Medicaid state, or and work with MCOs in managed care states, and it can get complex. But generally speaking, would love to hear about the codes that you're using, and then the
Sure.
policy center is hoping to develop a billing resource guide for maternal mental health services related to peers in the future, which some of these codes have been
Mhm.
previously documented because of your experience, Michelle, but I appreciate you sharing those.
Sure. So we'd use the initial screening code, which is an H0031. And the reimbursement varies from one plan to the next. We also use the case management code, which is broken down into 15-minute increments. And that's the T1016 case management code. And each one the reimbursement is based off of that 15-minute increments. And then we have peer support coaching code, which is H004004. And we can do up to an hour of peer support coaching, that type of session. And that again varies from one plan to the next. And so the averages, so when the reason we use the different levels here, whether it's coaching or case management, and again, the documentation has to reflect that it's actually falling under case management or this peer support role. Then we it helps us diversify sort of the revenue stream. So that helps us.
That's great. And some of these codes are actually applicable for mental health services more broadly. Case management potentially can be built. We have a billing code guide.
Sure.
I'll drop that link into chat for obstetric settings, including case management. I'll drop that into chat. Michelle, would love your feedback on whether those are some of the codes that you've mentioned here, or others as well. So we'll drop that into chat. Michelle, thank you for that very practical question. And we have 15 questions in
Okay.
chat, and I am going to open up that Q&A rather. There it is. Hi, Christina. Good to see your question here. Christina says, I've actually completed training as a perinatal behavioral health coach. And I have seen a couple of coaching programs
Mhm.
pop up, including one from I think, a beloved and well-known startup that's providing online and tech support for the perinatal population. And she mentions that she's developing a business practice to support these populations.
Wonderful.
Any next step recommendations? So, I mean, my thought here is, well, thank you. I think anyone really
Mhm.
can become a coach, right, and support these populations. If you want to bill insurance and take insurance and support the patients or the population that you serve, if you plan on charging, right, and want them to be able to use
Mhm.
their benefits, then you would also have to become a certified peer support specialist. Christina, I think you have lived experience and that might work. Michelle, anything else you would add there?
Yeah, I would say that, and I'm looking at the other questions, that plus getting that state certified certification is going to be key in order to be able to look at being on a bill. Now, I think, and I know that I really think that in this work that we do around maternal mental health, whether we're a coach, a therapist, a teacher, however we do it, getting that connection and supervision so that when those really difficult cases come along, that you're not isolated. I always recommend that to everybody going into this work, because we're dealing with such vulnerable people and vulnerable time of their lives. So get any support that you can so that you can provide best care. That's why I say to my whole staff, pretty much weekly, and they probably roll their eyes now by that, but we want to be able to provide best care, and getting support for yourself as you navigate it is going to be really important. But yes, getting the actual state certification, we worked through with RI, and then locally we now, again, collaborations are key, and I would encourage anyone to look in their communities of who else is doing that state certified peer support training. So for us, we work with a local organization called the Center for Health and Recovery. And we do that because we've been able to work with them to provide this certified peer support training specifically for our staff. And they understand maternal mental health. And so it's a little bit different than just going to RI and getting it done. So find out who's doing it in your community as well.
Yeah, that's great, Michelle. I'm glad you brought up supervision. Uh,
Hmm.
Leaders in peer support work outside of the maternal mental health space have long, raised the red flag that your supervisor really matters, having someone
Yes.
that understands the role of the peer, the critical role
Yes.
of the peer, even if they're doing work outside of the scope of their certification, Michelle, which it sounds like you're using peers in lots of ways, which I think is phenomenal and awesome. But if you're billing for peer services, like really to understand the limits of peer support, and the beauty and power of peer support, and also the need to talk through difficult cases, especially if it might
Correct.
trigger memories of someone's personal experience. So I'm so glad you flagged that. And I do see a couple other related questions. Again, it's really about if you want to bill time, or your employer wants to bill for your time, then you will need a certification in your
Hmm.
state to do that. There may be a couple of exceptions, which would be documented on that resource hub on our website. So let's see. Let's get back to some additional questions. I see one from Angie. in Oregon
Mhm.
related to reimbursement for peer support specialists through Medicaid being so low, hardly a
Mhm.
living wage. I'm glad that you flagged this as well. So, this is one of the challenges related to what we call there are various terms, but lay professionals or community-based professionals, so doulas, community health workers, and peer support specialists. This is a challenge for all of those professional affiliations, for those who want to become certified and bill the billing rate and reimbursement rate may be very, very low. To me, it's impossible to do this work as a solo practitioner and then
Yes.
bill. You would never be able to survive. And so this is
No.
why number one, yes, we need to increase those rates. And number two, I don't think anyone should be doing this alone anyway, for all the reasons. Like, it just takes a community to do this work. And so I think our peers and doulas and CHWs, me personally, should be doing this in community and have an employer who pays their salary or part-time wages, and manages the billing hassle and offsets potential losses of low rates through that employer. So that's one thing. And then the second thing is there is a lot of work happening. Karen Howard from Mental Health America, I see you on
Mhm.
the line. Karen Howard chairs the mental health liaison groups, peer support specialist work, and this is a group of mental health advocacy organizations that are working at a federal level, many at a state level, to tackle this and many other issues related to peer support. So we're in good hands with Karen and other champions to work on that living wage issue for peers. Others are doing the same work around, doula reimbursement. I think these things are going to start to change. We're hearing from CMS the important role that doulas and peers play, and hopefully every state starts to look at their reimbursement rate, and start to look at raising those rates so that we can actually have jobs and living wages to support proliferation of peer support. Michelle, what else might you add?
Um, I think, no, I don't know. I was going on reading. I'm going to be honest. I was reading some of the other questions because I was so excited about all the
Yeah, good. Well,
questions.
let's jump into pick one that you want to answer first, Michelle. That's
Um,
why it's fun.
I
It's a fireside
I think
chat.
we can do another whole like 2 days on this. I think that I want to go to, yeah, the like going back to what you were talking about with the rates, because there's another question that the rates are so low, and I just can't emphasize enough that for us, we couldn't just do our peers alone. So we having a collaboration within a system is the only way. But I do think in time we can show the value of this, how this system is working, so that we can improve those rates. However, I have had family members who were peer supports in other capacities, and they don't even get reimbursed. They don't get paid an hourly rate that's livable. So we have made a conscious effort, because of our different revenue streams, to ensure that we pay an hourly rate that people can live on. So that's important to us. And I think that's finding whether you start an organization or finding an organization that sees that value is really important in this process. And we figured out a way to kind of sustain it, because I'm always talking about sustainability, and it's um, just multiple avenues of revenue streams. And that is also why we are a nonprofit too. We're also a qualified charitable organization, because we need to have all of our donations go toward programs like this.
Great. Thanks, Michelle. Um, okay, great. Michelle, any other question that you want to pull out from the
Yeah.
Q&A? I know you jumped to a few. There are some good ones here.
So there was one question about someone in California asking about tips to reach out to partners. I believe you have a Common Spirit Health in system in California as well. And the reason we were able to work so closely with them is that Common Spirit Health as an organization actually picked maternal mental health as one of their focus areas. So I don't know if I believe you have them all over California, correct? Or is it just Northern California?
Common Spirit Health is in California and most of California. We're
Health.
actually in a
Okay,
pilot with Common Spirit Health as well.
awesome.
So we're happy to introduce you. We'll also have my email up in just a moment. We're happy to connect folks with Common Spirit or other hospitals. Michelle, you'd also talked a little bit though to think about the community-based organizations that
Mhm.
are on the line, or even maybe individuals with lived experience that are trying to think about how do I channel my experience into something like this, becoming a peer. Often hospitals will host a, a maternal mental health or perinatal mental health support group, or
Yes.
perhaps a broader support group just on parenting, but those leaders will have some sort of training in maternal mental health. Tell us a little bit about how that worked with your peers. Did they run support groups? Was there a curriculum? What did that look like?
Yes, so we have a partnership with one of our community-based organizations that work with um, low income or undocumented parents. And our one of our contracts that we received was to provide community support. It was pretty, vague, basically. So we partnered with them, and our peer offers a perinatal support group, just a regular postpartum parenting parent support group. And then we have an educational group on parenting and adjusting to a new environment and just resources, managing resources within that organization. And we provide that both in English and in Spanish. So that's really exciting. They work closely. We pull from some curriculum that we have seen. We've also done the ROSE program through. ROSE was considered a prevention program for maternal mental health, specifically for identifying with low income parents, pregnant people, and we've been able to implement that curriculum within the community based organizations. So that's been one way that we've used our peers that way.
That's
We
great.
also have we're working for next year for a NICU support group, and that would be led by one of our peers who's got NICU experience.
Great. Thank you. Really helpful. I think there's the really good question that Charlotte Burnett asks about the role of peers, and perhaps if there's a severe mental illness or substance use disorder in your clinic. Michelle, how does that work if the peer
Sure.
perhaps is the first to identify there's a problem there? How does it ladder up?
So all our peers meet with the clinical person and staff every single person that they've met with. And so if there's someone identified with a substance use disorder, then we may refer out for substance use treatment. Because if, we want to make sure we're providing the best care and we're all staying in our lane, but they have the education and the training around like what is substance, what does it look like, and what to do when. And then again, there's that that supervision and oversight so that we can say, okay, this would not necessarily be the right fit. So let's help them find the next level, the best level of care for them.
Yeah, very good. Thank you, Michelle. That's helpful. So, and we often talk about scope of, in this case, it wouldn't be
Practice.
licensure, it'd be certification and making sure that someone is sort of practicing,
Sure.
um, providing behavioral health interventions within the scope of their certification. And so thank you for answering that. And of course, there are substance use disorder peer pathways. And this is, as
Mhm.
we mentioned earlier, one of the ways that peer support was developed for substance use disorder. Michelle, are
I
your
wanted
peers?
to
Yeah,
Go
go
ahead.
ahead.
I wanted to address one about metrics, because that's always one we're always focusing on. What metrics do we track for success?
Mhm.
So we because this particular program is our bedside support program is connected to a community partnership grant. We're tracking a few different things. We're tracking engagement with our partners, engagement in any other additional services. But then our peer is also following up with everybody that they meet with. If they're a Medicaid provider or member, they are being followed up at 2, 4, and 6 weeks, and then determining at that point what the next level of follow-up would be. And then, and we're doing screening throughout the times that we're following up with them just to see how they're doing. But we also assess the number of services that they're engaging in. Then we also, to provide, in general, we will do self-report from our surveys with our clients, whether they're receiving peer services or other services, because we also want to know, are people getting better? What have they gotten out of what they've been experiencing? So there are a few different things that we're looking at with engagement and services, and then their EPDS scores, and then their overall satisfaction.
That's great. Yeah. It's called measurement-based care, right? When we look at
Mhm.
screening scores, and then generally it's 30 days later, rescreen to see if what we're doing is working. So Michelle, thanks for that that overview. Michelle, one person, Victoria asks, so to bill for Medicaid services, do you have to be supervised by a therapist? You didn't ask that quite that way, Victoria, but I'm modifying the question a bit. And then also have therapy in
Okay.
that same center to ladder up. How does that work? Do you have to have a therapist in Arizona on staff? Do you know?
Um, as far as so I'm reading that a little bit different. Being served, I'm reading it as wondering if they are being served by a therapist as well.
Yeah, go ahead and
So,
answer that,
okay, so
Michelle.
most of our the clients are being served by a therapist as well. However, they can meet their therapy goals, and we actually do have many people like this. And so they terminate from therapy, but they're still meeting with their peer because they're dealing with parenting, needs, or day-to-day just adjustment things that they've need somebody else to provide that. We saw a lot of that, especially during the pandemic as well, when there was so much isolation. But we do have some that will just see a peer. We may, if depending on, have them just connect with a therapist once to just kind of check in to see if there's any other needs, to evaluate if there's any other needs beyond that. So it just depends on the need of the client, really. But we do have some that will do that. Now, as far as the supervision goes, yes, all of our peers, it doesn't, I mean, it's our policy that all of our peers have supervision. Just no different than our associate level therapists. They have supervision for their licensing. All of our peers have supervision because we want to minimize any transference. We want to minimize any triggers. We want to check in to make sure they're doing okay. We also want to protect. I think supervision is really healthy in protecting the client, because we want to also, everyone needs to, we don't want to be serving outside of our scope. And for example, I use that as myself. I still carry a small caseload. So I, I don't treat eating disorders, say. So if I get somebody in is experiencing an eating disorder, that's outside my scope. I'm going to refer out, and we want to make sure that we're providing that kind of good care that has integrity to it. So all of our peers will receive supervision.
Great, Michelle. Thank you. And I should also add that CMS requires, so for Medicaid reimbursement, will require that peers be supervised by usually licensed behavioral health provider. Some
Mhm.
states are interpreting that a bit more broadly
Yeah.
to allow any clinician to supervise a peer, but you will have to be supervised by a peer. So community-based organizations, or I'm sorry, a licensed provider, likely a licensed behavioral health provider. So CBOs, community-based organizations looking to do this work, that will be an important consideration. Michelle, we are out of time.
Time. I
I
know.
just want to say thank you. It's like the start of a conversation. I knew our audience would love to have this chat with us. And so it's been fun to have all of you join us
Yes,
today.
thank
About
you.
120 live, and then others, we had about 400 people registered to watch virtually later. So thank you all for joining us. We are going to advance to the next slide and just share a couple remaining resources before we wrap today. We wanted to share, we mentioned that there's an add-on training. So the way a peer can become a state certified peer support specialist is first to become a certified peer in their state. You have to look at who does the training in your state, and then sit for the test in your state. If there isn't a mental health training, it's all SUD, outreach us, and we're going to prioritize that state around the policy opportunities that still exist there. But you become certified as a general peer support specialist in your state. And then we offer now an MMH, maternal mental health add-on training that was developed by POEM, Mental Health America, Ohio. Many of you may know Tanya Fullwider, who is just another longstanding champion in maternal health, who's been doing peer support work in Ohio for quite some time, not certified peer support work because there are gaps in Ohio, but nonetheless has developed this really incredible curriculum for mental health peers. So we are partnering with Tanya and her team to bring that add-on training to all of you who may be certified peer support specialist in your state. If you're not yet and still want to take this training, you can send us proof that you are on your way toward becoming a certified peer. And for those of you who aren't individuals, but organizations, and you have questions, you can outreach us about this as well. Postpartum Support International also offers the PMHC pathway designation for lay professionals. Again, that's our term, community-based professionals. And so that's another way to get additional maternal mental health training. Next slide, please. The last thing we wanted to share is just we appreciate you joining us today, and we ask you to stay on for just a minute. There'll be a pop-up that comes up when we end the Zoom session today, and we just hope you'll answer 2 questions for us about the content of today's session and give us some feedback. And lastly, you can find our website on this next slide. And we invite you to stay connected and learn more about the resources that we shared today by visiting our resource hub on peer support here. Thanks so much again, Michelle. It's been
Yes.
a pleasure.
Thank you. And I put my email address in the chat as well. So I'm happy to answer other questions offline. So thank you so much for having me.
Thanks, everyone. Thanks, Michelle. Happy
Okay.
summer.
Thank you. Bye.